Okay, today we're going to be going over inserting a Foley catheter. I always would start introducing myself to the patient, doing my AIDed principles, checking the order, determining if the client has any allergies, and educating the patient on what we're going to be doing and for what reasons. I would adjust the bed to a height that's comfortable for me, make sure I have all my supplies. I'm going to start off by uncovering the patient and getting them into the position I need for the Foley insertion. So I'm going to pull back their gown, pull down the blanket, and then put their knees in a position that appears to be like frog legs. Okay. Now I'm going to start with performing hand hygiene again, and I'm going to open my kit. You can bunch this up and use it as a trash. That's what I'm going to do for this video. This will be the label you'll fill out once you've completed the Foley catheter with your initials and the day it was inserted. This is sterile, so we're going to open it with away from us first, and we're going to be sure to only touch the 1-inch border. Then I'm going to do the sides. And then I'm going to open the last one towards me. If it's not staying open, you can try and pull it taut without reaching over in an attempt to keep open. Okay. There are sterile gloves on top that you would put on so you can handle the equipment within the kit, but I'm going to opt to use my own. With that being said, you don't want the sterile glove package to touch the Foley sterile field. So just be mindful of that. You're going to turn it where it says cuff end towards you, and you're going to open it in half first. And then you're going to see flaps on the top and flaps in the middle. I'm going to first open the flaps on the top and try to bend it backwards to get them to stay open. And same with the bottom. And just like the Foley kit, the first, the inch around the border, the inch border is the only thing you can touch. I'm going to turn this way to manage my sterile field. So if your glove is stuck like this, you can try and use the other glove to hold it down without contaminating it to pull it back. So again, 1-inch border, you're gonna pull it taut. I'm gonna glove my dominant hand first. So I'm going to take my non-dominant hand, grab this glove. You can grab the cuff part, but you can't touch anything outside the cuff part or the paper. If it's stuck, you can take your hand, this dominant hand, and hold this, the 1-inch border, to keep it down. And I'm going to insert my dominant hand into the glove without touching any of the fingers. So you don't want to touch the fingers. You can touch this portion because this portion is going to pull down and go against your skin. We're not going to pull it down right now. We're going to pull this one down once we have the other glove on. So I'm just going to leave it like this. I'm going to take my 4 fingers and I'm going to put them under this cuff here. And then again, if you need to stabilize the paper, you can hold the 1-inch border again. And I'm going to put this on my non-dominant hand now. You don't want to let this thumb touch this hand by accident, so pay attention to it. And then you can pull this one down again without contaminating the other glove. And then you're going to take your non-dominant hand, go under the cuff. Make sure, again, you don't touch this because you've already contaminated this, and pull it down. All right, and then your gloves are done. So now I can freely touch everything in this kit. So I'm not going to use these gloves. You're going to have 2 drapes. One side will be shiny or gritty. So find your shiny side. That's the side that's going to go down. So this has to go under the patient's buttock. So you're going to take your thumbs and put them at the corners and your 4 fingers behind and wrap to protect your hands, to protect your gloves to remain sterile. and I'm gonna move it over. You have to be sure, so move your table if you have to, that you don't contaminate your gloves. Okay, and you're gonna come back and move your table back in your area. There's another drape, similar. You don't want to fling it over your sterile field, but there's going to be a hole, and this hole should be the opening over the patient's vagina. So again, I'm going to bring it over, open it, not over my sterile field. So you wouldn't want to open it over your kit over there, and you're going to want to align it to where you have a good working area, but everything else is covered because now all this is sterile and I won't contaminate. And lastly, I'm going to take this whole kit over to the bed with me. This is what you're going to use to inflate your balloon. This is what you're going to use to clean the patient, and then this is lubrication. So I'm going to get rid of this before I move it over. Sterile specimen cup, we don't need that right now, so I'm also going to set that to the side. And in the meantime, I am going to uncover the tubing for the Foley. You want to make sure, again, you're not flailing this around. So you're going to carefully take this off because you don't want to let the tip of this touch anything because this is the part that will be inserted into the patient. This is the lubrication you're going to put at the tip in order for it to go in easy for the client without pain. I'm going to rip the whole thing off and just put the tip into the container. And now I'm going to grab this kit and I'm going to move it over to the bed with me. And I'm going to place it on this sterile drape, making sure I'm not touching the patient with my hands. So before we can insert this, the patient has already been cleaned up with Pericare, but we have to use iodine or another type of antiseptic before. So I am going to open these. I'm not going to put it on the patient because this is a mannequin and I don't want to stain the mannequin because, as you can see, it's very dark. You have 3 swabs here. One at a time, you're gonna go from outside to inside. So I'm gonna take my first swab, leave those right there. I'm gonna take my non-dominant hand and I am gonna put, peel back the labia to clean. So I would peel back here, I would go away from me first. So first side down, so from the top to the bottom of the left labia. I'm going to come to the right labia and again go from top down of the right labia. And then I'm going to do the urinary meatus. I would go straight down the middle to clean the urethra opening. I am now going to take this top off my syringe. I'm done with these. And I'm going to fasten it where I would inflated the balloon. So here, typically you can do this before you touch the patient to make it easier. I already put the tip of this in the lubrication, but I'm just going to push it out to make it go further. And now I'm going to grab the tip. Again, we don't want this to fall around, flail around, and accidentally touch the patient or anything outside of where we're inserting it. So then I'm going to, once that I have this secured and it's lubricated, I'm going to insert it. And in this video, you're not going to see urinary return, but what you would see is urine to start to come into the tube. And after that, you're going to insert it another 1 to 2 centimeters. Okay, I've seen urine, I inserted another 1 to 2 centimeters. Now I'm going to use the plunger on the syringe and I'm going to inflate the balloon. And then you want to take this off because the water will come back out. I'm gonna gently tug, make sure that I have resistance. I have resistance, so the Foley is in. Now the sterile part of the procedure is over, so you don't have to worry about what you're gonna touch. You can take these gloves off and put normal gloves on because they're gonna be full of lubricant and iodine. All right, so I put my other gloves on, and we wanna make sure that we clean our patient up, but also there's some things you wanna do with the Foley. So you wanna keep the Foley at the side of the bed, below the level of the bladder. Make sure there's no kinks so that the urine's not getting backed up and causing further issues. So there would be urine in here. We're gonna stretch this out. There's a hook here that you're gonna attach to the side of the bed. All right, we're gonna leave it here now. You wanna make sure that there's no dependent loops. So you can use this as a clamp to clamp it down here to keep it straight, and then attach it here. And then your Foley line is generally straight. You want to let the patient's legs rest, remove the drapes. This one you can just tear. Get rid of all your trash. And then cover your patient back up and make sure they're comfortable. You would always want to do the same principles you use when you're leaving the room. Make sure the patient's in a safe position, they have their call light, fall precautions are in place, and that you address any needs they have. The purpose of this demonstration is just to review how to clean the male client. If you were inserting the catheter on a male, you would still insert the Foley catheter through the urethra the same way, but this is how you would clean. So you're going to use the same 3 swabs, and you're going to use a circular motion to clean the upper half of the penis and the urinary meatus. You're going to start at the meatus and go around in a circle and come just past the upper part of the penis. And then you're going to use another one and go in the same direction. And then you would use the last one and again go in the same direction. Now we're gonna go over how you would collect the specimen. So you never want to take a specimen from the bag. That's not considered a clean catch. So what you would do is the same clip that you use to clip this tube to the bed here actually can serve as a clamp. So you're gonna bend the tube, and then you're gonna insert that tube into this hole here, and it'll stay clamped. With that being said, you only can leave it clamped for 15 to 30 minutes. And you want to make sure that you don't leave it clamped longer because the urine can back up and cause further issues in the urinary tract. So let's say it's been 15 to 30 minutes. This whole thing is going to be full of urine. Therefore, I'm going to use my syringe to draw out of this port here. So this port, you would need another adapter to connect to the port and then be able to connect a syringe to it. We don't have that adapter, but I'm still going to demonstrate. So before you would actually draw anything out, again, because this is a sterile line, this is going right into their bladder. We don't want them to get a UTI, and we're going to access it. So we would clean it with alcohol. You're going to use the basket weave method for 30 seconds, and you want to let it dry. Okay, we're going to say it's been 30 seconds and that it's dried. Then I'm going to use my syringe. I would draw from here. You can draw up to 10 cc's. You have your urine. You're going to take a urine cup. It should be sterile, so you should have to break the seal here. You would put the urine in here and then close it. Fill it out, label it appropriately with your patient's information, and send it down to the lab. So next, we are going to discuss removing it. Once you're done with the collection, make sure you unclamp this because you don't want to leave the Foley clamped, and make sure it's not too kinked. We're going to use a syringe similar to the one that we used to inflate the balloon. So you're going to insert an empty syringe back into the same port that we used to inflate the Foley. And once you do that, the fluid may start to come out on its own, or you can also pull back. But you don't want to pull back too fast, because if you pull back too fast, all the water won't come out. All right, so I got that out, and then I'm going to do it one more time just to ensure that I got everything out, so I'm not pulling out a balloon that's still inflated. You don't have to alcohol this port because this is a closed system. It only goes into the balloon, so you don't have to worry about contamination. So I got all the water out. You're gonna tell your patient, you can ask them to take a breath, and then you can pull out, and then you will see there's no balloon. Once you do that, you're gonna dispose of this in the appropriate facilities, and you're gonna wanna monitor your patient to ensure they start to urinate on their own again.